Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing another antidepressant that goes by the name of Mirtazapine. Its brand name is Remeron. Before I start discussing the medication itself, just keep in mind that this channel is for information purposes only, and it's not to be used as a source of recommendations for your personal health care. Mirtazapine is classified as an NASSA, which stands for a noradrenergic specific serotonergic antidepressant. So there are many different indications for Remeron. The one that we see most commonly would be for major depressive disorder, or MDD. This can be with or without anxiety. It can be used to treat sexual dysfunction associated with SSRIs. Preliminary reports have shown efficacy to use mirtazapine in generalized anxiety, obsessive compulsive disorder, PTSD or post-traumatic stress disorder, as well as social anxiety disorder and premenstrual dysphoric disorder. Mirtazapine has been shown to be effective in pervasive developmental disorders such as autism. In these individuals, it's thought to help with irritability, self-harm, aggression, hyperactivity, potentially anxiety and depression, and finally insomnia. Mirtazapine or Remeron may be beneficial in treating the negative symptoms associated with schizophrenia. A low dose of about 15 milligrams of mirtazapine can be used to treat akathisia. Some data indicates that it can be used in chronic pain such as a tension headache. And finally, some reports show that it may be beneficial in alcohol withdrawal. Now, before somebody was to use mirtazapine or Remeron, there are some precautions that they should be made aware of. As with all antidepressants that we discussed up until this point, upon initiation of therapy, it's important to monitor for worsening of depression as well as signs of suicidal ideation. We should monitor for these parameters throughout the course of therapy, but especially when there's a change in dose, whether that be an increase in dose or a decrease. It must be used cautiously in individuals who have liver impairment or kidney disease. If a patient using mirtazapine was to develop an infection, their white blood cell count should be monitored. If the results come back that they have a low white blood cell count, they would have to discontinue therapy. And finally, it should be cautioned that mirtazapine does have the ability to cause mania when used in individuals who have bipolar disorder. Once somebody is made aware of the precautions and they start using the medication, typically they would take it in tablet form. Regular tablets are available in 7.5 milligram, 15, 30, as well as 45 milligram. There are also oral disintegrating tablets, which are available in a strength of 15, 30, and 45 milligram. Typically when this medication is started, it's given at a dose of about 15 or 30 milligrams daily for about 4 days. It is then increased or maintained at 30 milligrams for about 10 days. If this is shown to be ineffective, some physicians will boost the dose up to 60 milligrams. It can be taken with or without food, but it should be noted that if you take it with a meal, it could possibly slow down the absorption of the medication. The oral disintegrating tablets take about 30 seconds to break down under your tongue. They can be swallowed with or without water, or chewed, or just allowed to sit there and dissolve. Mirtazapine would reach its peak plasma concentration in about 2 hours after you took a dose. Interestingly, females, or the elderly, show a higher peak plasma concentration level of mirtazapine than do males or younger adults. Hepatic clearance of mirtazapine is decreased by 40% in those who have cirrhosis. So as with all medications, there are some adverse reactions or side effects that people may experience while using mirtazapine, so I'll list some of those side effects here for you now. Fatigue or sedation happens in about 30% of individuals using mirtazapine. There seems to be less sedation when individuals use a dose over 15 milligrams, as the medication would have more activation on alpha-2 receptors and more release of norepinephrine. During the acute treatment phase, this medication may decrease your ability to perform hazardous tasks, such as operating heavy machinery or driving an automobile. It's important to make sure that you know how the medication makes you feel before performing such tasks. Now, I know we just talked about it causing sedation in 30% of individuals who use it. However, some people do experience agitation or restlessness when using mirtazapine as well. Very rarely, this medication may cause delirium, hallucinations, or psychosis. Some individuals may experience anticholinergic side effects from mirtazapine, such as dry mouth or constipation. They would happen more frequently than sweating, blurred vision, or urinary retention. Some people may notice a change in their blood pressure, as well as a change in heart rate. 1 to 2% of people who try mirtazapine may develop some edema. Some people that use this medication may experience weight gain. About 16% of people notice an increase in weight by 4 kilograms or more. This may be correlated to the increase in appetite and the carbohydrate craving that some people get while using this medication. Some individuals do experience stomach upset. Some say they have a bitter taste in their mouth when they take the medication. Others may experience vomiting or diarrhea. There is a risk for sexual dysfunction with this medication as well. There seems to be more of a risk in the elderly population, as well as those using it at a higher dose. There have been rare reports of tremors and hot flashes. And finally, there have been reports of mirtazapine causing rhabdomyolysis. This could happen whether you use the medication alone, and it's also been seen when the medication is used with risperidone. There can be some discontinuation syndromes that occur if an individual was on this medication consistently and stopped it abruptly. So as with most medications that treat depression, it's usually a good idea to come off the medication slowly. Your physician or pharmacist can help you taper off the medication if you so choose that you want to stop taking it. That's all we're going to talk about today with mirtazapine or Remeron. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. Alright, take care.